We're back on MD-VOD, where we're talking to HIV specialist Dr. David Hardy, and we're taking your questions live. First question is, I've heard about home kits for HIV. Are these reliable, and what would you tell viewers about them?
Home kits were approved by the FDA this past summer. I believe it was June or July of this summer, 2012. And they were the culmination of a lot of long-time testing of a simple finger prick blood test that can be done, or a swab across the gums of someone's mouth to be able to screen for HIV infection. What's important to remember about the home kits is that they're simply a screening test. They're not a definitive test. If someone buys a home kit, uses it, and discovers that the test is positive, what it means is that that person should very quickly go to their healthcare provider or to a clinic and confirm that that test was in fact truly positive. That test is a very important tool for being able to empower people to discover whether they have HIV infection themselves. It used to be that the test was only available in doctors' offices and clinics. We went through a consent form problem for a long period of time, which was finally struck down in California in 2008. So this really empowers people to find out for themselves in the privacy of their home whether they're HIV positive. But the kit by itself is not enough. It's important that if the test is positive, they should go to the doctor's office, go to the clinic, and have the test confirmed with a true blood test drawn from one's arm. It's a screening test, not a definitive test.
A great point. So those home kits are very useful, but again, need to be followed up with a definitive blood test to confirm. That's great advice. Next question is, what about a mother that has HIV? Will the baby automatically be infected with HIV? And does the baby have a higher risk of developing HIV later in life?
Well, we know from many studies that were done before there were medications available to treat HIV infection, was that about 35% of untreated mothers with HIV infection would transmit the virus to their baby. Sometimes it was even higher than that, as high as 50%. But the good news now today, John, is that we have been able to really squash the transmission of HIV from mother to child by giving the mother medication either the last trimester, the last 3 months of her pregnancy, during the time of delivery, and to the baby as a minimum. Or what we do most of the time here in the United States is, if an HIV positive woman wants to get pregnant or is pregnant, we start therapy the minute she either wants to try to get pregnant or the minute that we find out she is pregnant, and continue the HIV medications throughout her entire pregnancy, through delivery and afterwards, in order to try to decrease transmission at every point. Currently, the transmission of HIV infection from mother to child in the U.S. is minuscule. It has been decreased to less than 20 cases per year, whereas before it was well over 500 or more per year before we started doing this. So, you know, this is something that if a woman has never gotten any prenatal care, she's about to deliver a baby, this rapid test kit that we just talked about can be used in a hospital to find out if a woman who never received any care, perhaps during the time of her pregnancy, to be tested for HIV. If the test is positive, therapy to prevent transmission is instituted at that point, during the time of labor, delivery, and also to the baby as well. If an HIV positive mother does have a baby, we recommend that she not breastfeed, because there is also a possibility, even after the baby is born, that the virus can be transmitted through milk. Through breast milk. So the good news is that no longer is that a problem in the United States. As long as we know the mother is positive, we can institute therapy right away and actually prevent transmission very nicely now.
Wow, that's incredible new. It sounds like a fairly new advent. Next question is, there's a new development in HIV. It's a pill called the Quad. What is the Quad? We know it's new. Can you tell us about, is it available? Who's getting it?
Sure. It's really no longer called the Quad. It's now called Stribild, S-T-R-I-B-I-L-D, is the commercial or proprietary name of the medication. It was called the Quad simply because it is 4 medications which have been co-formulated, or basically squished into one pill, one fairly easy to swallow single pill. I've done research with the medication myself through our research program at Cedars-Sinai, and have found it to be well tolerated, and in large clinical trials it was found to be as good as currently available medications, which are in the preferred categories of what we recommend to treat HIV with. So the quad now, which was approved by the FDA, I think about last week, is now our third, what we call single tablet regimen. Again, remembering we use at least 3 drugs to treat HIV infection. Instead of having to take 3 or 4 separate medications, putting them all into one pill has made it very simple for people to take their medication on time, regularly, without skipping doses, without missing doses, and the quad is a third of those that has come out in the past several years. So it's another, I think, important advance. It has advantages over some of the ones that are out there now, and I think will be something that we'll see and hear more about in the future.
Is there a variable right away? I'm thinking, you know, are some of the drugs in the quad absorbed better than others? Is there any problem with that, or?
Well, it doesn't seem to be so. You know, one of the things it takes to get the medication approved is to show that the 4 medications put into one pill are just as effective as each of the medications given separately as far as how well they get into the blood. So that kind of testing is required by the FDA prior to having the FDA approve the medication as a single tablet being used on a daily basis.
And our next question is, how does diet and exercise affect someone with HIV and AIDS? It's a great question.
You know, I think it is a great question because it's one I've heard since 1982 when I first started taking care of patients who are HIV positive. And even now today, 30 years later, I think the important thing about diet and exercise is that they're great ways for people to be able to relieve stress, great way for people to be able to actually build their T cells. There were studies that were done that showed that cardiovascular exercise on a daily basis actually increased T cell counts, the cell that are attacked by the HIV, by the virus, and can be decreased. So doing something that may increase that through daily cardiovascular exercise can be very important. And of course, diet's important as well. HIV is a disease which kind of tears down people's body by requiring a lot of energy for the body to fight against the virus. So by the time people are diagnosed, their body is oftentimes depleted, of protein and of certain minerals. So it's very important to replace those minerals, especially when someone's being treated, as their immune system is rebuilding and their body is rebuilding. So diet and exercise do play a very important role in the good care of HIV positive people.
That's great advice. So exercising can boost or augment your immune system. You know, I've heard that there are some healthcare providers and some programs out there. I think you mentioned it earlier on our show, but I think it's important to revisit. There are programs out there to help people that might not have money to afford some care. Are there programs out there that you're aware of that might help people that have HIV and AIDS that might not require insurance?
There's several. As I mentioned before, there are state and federal programs. There's the ADAP program, the AIDS Drug Assistance Program, which is funded both by the federal government and our state government in each of our states. They're varies state to state, but the one in California and the one in New York are particularly good at covering not just HIV medications, but other commonly prescribed medications as well. There's the Ryan White program, a pure federal program, which makes available health care, including medications, to people who kind of as a treatment of last resort can't get Medicaid or Medicare. And then there's also the pharmaceutical industry has made, all pharmaceutical companies basically have what's called a patient assistance program, a PAP. If you go to their website, you can actually see how all these companies make their medications available for free usually to people who don't qualify for one of the other programs or who have insurance that doesn't cover pharmaceuticals, and that's another important way to be able to treat and make medication available, because paying for it out of pocket can be very expensive.
Well, that's great take-home advice. I want to thank Dr. David Hardy for joining us today and talking about a very, very important disease for all of us to know about. If you missed any of today's show, make sure to go to emPOWERme.tv, MD-VOD. Thank you so much for joining us, and make sure to check it out. See you next time. And now, for any episodes you might have missed, they're available at the emPOWERme.tv website and the YouTube channel. And be sure to leave us any comments and questions so that we can better help you deal with your disease. We'll see you next time on MD-VOD.